baby likes, but...
It's 10 o'clock on Tuesday, February the 4th. This is the City of Topeka's governing body's Social Services Grants Committee. I'm the chair, Karen Hiller, to my left.
Councilwoman Valdivia, Christina Valdivia Alcala, District 2.
To my right.
Mike Padilla, District 5.
We have staff from Neighborhood Relations Department. Thank you so much. And from the council office, and we have some city manager is here and some of the social service directors in the audience. This session we planned about a week and a half ago as a kind of soup to nuts work session. So staff has provided us a lot of historical material. Two of the three of us are new to this committee this year. The process is underway to outsource the actual grant allocation process and grant management. We wanted to get totally up to date on what we were inheriting here. We still have some voting to do in terms of process before that gets handed off. So we thought we would have a long meeting. This meeting may last 2.5 hours, we'll see. And we wanted to just kind of start at the beginning and work our way methodically through all the elements of this process. Anything I forgot to get us started? Okay. This is the first time that we've seen some of these materials, so there may be a little bit of slow start for that too. First though, I will call the meeting to order. We have minutes from the meeting of January 27th. I would entertain a motion to approve, or if there are comments or concerns. Those came out with your agenda. They were not in the handout packet.
Oh, I see it.
Find them? While they're reviewing, we will take a break somewhere between the hour and a half mark, just sort of whether we need it or not as participants, and also so that they can change the tapes for the recording. So.
Motion to approve.
Motion by Councilmember Alcala, second by Councilmember Padilla to approve. Discussion. All in favor say aye.
Aye.
Opposed, same sign. All right. Moving on. What we inherited to get started with this is, what's it been now? 10 years maybe? 10 years of social service allocation done by a council committee. This might be the 10th year, something like that. Each year there's a priorities sheet. This sheet was developed by last year's council, our committee, and was approved by the council. So unless there's something really flaming about it, this is what we're starting with, because it would have to go back to council to change it. So just wanted to briefly review. Staff, could somebody walk us through this sheet?
Sure.
Thank you.
Not too much changed from 2020 to 2021. We included both of those in the packet for you. The minimum grant amount is $10,000. That's just due to making sure it was worth staff time, agency time, et cetera, to get the minimum amount there. Maximum grant amount is $25,000. New programs that are available to apply for $15,000, and those are programs for organization not established with the city during the last 3 years. So that would be a new organization. They could apply for up to $15,000 that at the beginning there. So the committee continued with the formula where if the applicant requested, say, 25,000 and got 95% on their application score, then they would get 95% of what they requested. And that was continued. That has been the process for several years at this point. So at least 3, maybe 4 that I can remember now. So, any questions?
If we can back up,
Sure.
both for the viewers as well as for the committee, the actual categories that the city would be interested in funding are up at the top. And so that would not change.
Yeah, those did not
Not
change
anything changed.
from 2020 to 2021.
So what's important there, just to review and kind of get ourselves focused, is that the mission statement is quality, cost-effective social services to handle our vulnerable citizens with care, minimize victimization and crime, minimize turnover in neighborhoods, and optimize success. And there are 6 categories: senior citizen neighborhood-based programming, to include meals, activities, and transportation, medical assistance for low-income individuals, programs for at-risk youth, emergency housing and utility assistance, neighborhood and independent living-based services for persons with severe and persistent mental illness, and a support for residents who are non-English speaking. So those really haven't changed over even more than the 10 years. Is that correct?
I would say those have been consistently the same. Maybe wordage has changed slightly from year to year, but it's been pretty consistent.
So this is pretty historical for the city's grant funding. The minimum and maximum grant amounts haven't changed in a while either.
Not in a few years.
Pretty
yes.
consistent. The grandfathering was new when the $25,000 cap was set.
Yes.
At the time, there had been a time when there were some agencies who were called contracted services who were in this pool who provided more substantial services about 5 years ago. Most of them were pulled out. That was the battered women's programming, housing and credit counseling, and Safe Streets, for instance. There were about 5 or 6. And they were pulled out into the departments that they are linked to. I think all of them had more than 25,000 in funding. When that happened, and the group was trying to make sure that the funds got dispersed and there was a way to contain it, that $25,000 cap was put in at that time. And at that time, there was a decision that the Shawnee County Medical Society and Positive Connections requested an exception. That's been discussed from time to time. That grandfathering, if you want to call it that, has carried through in terms of last year's recommendation. New untested programs. The idea was that there would be, what has ended up in here is that there'd be 15,000 available for, the way it's phrased right now is for organizations not established with the city during the last 3 years. The way that works out then is that there's no limit yet. One of the things that happened in the course of time was agencies that were already active with the city, with language at least kind of like this, requested new programs and instantly were able to get as much as $25,000. They were in full competition with the other programs that were in there. Whereas an agency that had not been funded got capped at $15,000. And also, when the scoring occurred, you all waived a couple of categories for them.
Not sure if waived would be the right. We did reduce the total points allocated. So certain points in the system were maybe 10 points for prior year's outputs and outcomes, for example, if we don't have that data. So instead of a 100-point total, it would go up to like 90 points, for example. So it was, the weighting was a little different, but yeah, they were still getting scored in all the areas, but not being penalized for us not having that data for prior grant purposes.
That makes sense.
It makes sense what she's saying, but I guess I'm thinking if a new program comes in and wants to get funding, what are we looking at in the past that they've done to make, to warrant funding? Mm-hmm. Am I missing that? I'm sorry.
I think I understand what you're saying. I think the way that we were looking at it was we would have the history because they were a grantee of ours, and we'd be able to look specifically at what they said they were going to do versus what they were going to do. And so if we don't have that history, then it was hard to evaluate. So
Right.
It was just reduced. So instead of 100 points, they had 80 points possible. So they weren't being penalized, but they also weren't getting points that were not warranted.
Right. I understand that part. It just seems like for new programming, well, maximum, that could be anywhere from 1,000 up to 15,000. That just, for new programming, that just seems like a lot, but that's fine.
Well, it's something that has been discussed before, and as we move forward, again, this is what it says this year.
So it's
But
set in
there's been
stone.
some conversation that maybe we shouldn't, you go back to the priorities that are listed, but, are we wanting to provide startup money with this money, or are we wanting to support existing programs that have demonstrated that they understand needs and outcomes and that they're meeting those outcomes? As a nonprofit manager in the past, it's easier to get startup money than long-term money, to get something going than to sustain it. So as we look forward, one of the other things that did was if an existing organization could bring in a new program, but an outside organization couldn't, because there's never going to be enough money the way it's going right now for a new. There have been new agencies that got in, though.
Yes.
The scoring. It's just something to think about, as we move forward. Same thing, there's been discussion about the grandfathering and whether at this point that should stay or not. But that's in there now. And
It's all been voted on, so it's a done deal for this
As we go
year.
into discussing the scoring and the admin of this program, I wanted us all to understand, what we've got, what some of the considerations have been, because it will be our charge. The way it went last week when we met, I see our year of service divided into 3 pieces. We're going to be meeting now until we're satisfied that we've got things figured out for how it's going to run this year. Then we agreed we wanted to meet and look at particularly the senior services, maybe all of them, which logically would be sometime this summer. And then the normal calendar for this committee is to meet in the fall once the grants are awarded, once the city's budget is final and the grants are locked, to start the process of what would the priority sheet look like and what would this committee recommend to the council for next year. And in a perfect world, that gets done in the fall. It's done in a lot of October, let's say, so that report has been to the council before December, therefore before the council changes, before the committee changes. So, the grant total, you can see, sometimes you'll see different numbers depending on what document comes out, but the total together is $434,904. Just to look back, that is, and I'm not sure why exactly, but is roughly equivalent to what there was last year, the 440,000. And that too has been fairly, there was one year. Can you talk about the stability? Well, actually, we have a 5-year run. That may tell us more.
You do have a 5-year run. However, the contracted services were in there for the
Gotcha.
first 3, so it looks a little different.
Okay. But that, is that 440,000 level? That's pretty consistent too,
Yes.
isn't it? Mm-hmm. I guess we could figure it out for the, oh, contracted services are at the top. Do they have a sub? No. When you look at the 5-year history piece that they brought us, it does have those contracted service agencies. That's this, the chart.
This one.
When you have time, it separated them into contracted services, emergency aid services, and then the other social services. So you'll be able to look through that and get a more clear picture. You can see what departments the contracted went to. So you can see the rhythm in there too, that some have entered, some have missed a year and come back, some have come and gone. Thank you so much for this. This is helpful.
Sure. And I would say the contracted services were running like right around 290, 300,000 in prior years before they got transferred outside of this process.
There was one year that we cut it substantially because you all were concerned that you were going to get a cut in the federal grant, if I recall.
We reduced the CDBG funding by like 50%. Down to that 67,000. Sorry, down to 67,000. Yes, because we had concerns about our federal funding, and then maybe the year after that, the general fund amount was reduced by about 100,000, and that was just due to budget constraints. The budget office and city manager's office told us to reduce it by 100,000, and the committee
Well, we must have
supported
bounced
that.
it back up because with those
Do
high
you remember
numbers.
what year that was, ladies?
So in 2016, the contracted service amount was 300,000, and then it went to 229,000 in 17, and then 211,000 in 18. The year that Sasha was referring to,
Where
was,
we reduced the general fund amount by
yeah,
100,000.
But in these years, 16, 17, and 18, and I'm not doing the math exactly, but that still puts us over 400,000 for the social services block grant itself in each of those years, right?
Yeah.
Looks like it. So it would be probably 19 totals where the 100,000 was backed out. And it's harder to see
Prior.
it because the contracted services dropped off and it all kind of came together at about
I have
the
a
same
question.
time.
Okay, let's back up, let's roll it back a little bit so I can get a better understanding. Help me understand the definition of contracted services. And we know that's different than those two that were grandfathered, but I want to be able to understand just an easy definition of contracted services.
That was services that we were funding, that if the city didn't fund them to an outside third party, they would end up doing it themselves internally.
Okay. And so it has TPD on 2020 approved and 2019 approved, and the TPD meaning, is that under the
Police department.
police department? So
So
that
this
came out of
committee
their
doesn't-
budget?
Yes,
Okay.
yes.
I have
Same money, it just got shifted around so that they were totally responsible for the grant instead of it
Okay.
going through the committee.
Okay.
If I may, the social service in 2016 is totaled approximately, because I'm not a finance guru, but approximately 442,487. And then in 17, that's where the 100,000 came into play. That was 555,518.
Oh, yeah, you can see it reflected in your grand total there at the bottom. We went from 784 to 618. Yes.
And then in 2018, 407, 192, and those are just approximate numbers, but that should get us really close to what it looked like over the last few years.
Okay.
And then the final number, just so you're clear on the 2020, that is with the addition of the 40,000 that the city manager found, and so
Right.
that's why it looks a little bit higher on the
Okay.
2020 number.
Thank you.
Bibles, don't touch them.
And just for what it's worth, to fill in the history, the reason that those contracted services were in the system at first was that the council, when the council decided to have the council committee do this, really wanted to make sure that all of the grants were outcomes-based, that someone was minding the store and watching whether the performance had actually occurred in terms of achieving outcomes, as well as whatever outputs and activities and outputs they'd said they were going to do. Because it hadn't always happened if they were like just in the finance department or in a certain city department, that they felt like it would be better to run them all through one core system. I don't know whether at this point those contracted services have continued to use our application form and process or not when they went out to the departments. Do you know?
Ours did not. We had a contract with the agencies. We do follow their outputs and outcomes, so we have similar guidelines, but it's a contract that we have with them. I'm not for sure about TPD. Do you?
TPD took that same
Same.
contract and modeled it so that they are listing the outcomes that they're paying for.
Okay, good. So, that 440, reasonably, 430, 440, has been kind of the sweet spot that the council has settled on over the years. Do you want to go any further? Are there questions about the priority sheet or the history? Just want to get grounded.
Just one quick one, if I may. Thank you. And it may show it on this graph here, but just a quick answer. That for the support services for residents whom are non-English speaking, I see a couple on there. Are there, I would imagine, multiple programs that address that issue? And could you, if not specifically identified on here, could you point them out for me?
So the Community Action, Latino Family
See that one?
Development, yeah, El Centro Community Resource Program. That's really tiny print, sorry.
No, that's all right.
That's pretty good.
Those are the two main ones, but
Yeah,
many
and
of
I
the
don't
agencies that are being funded with our dollars also have, services for people that don't speak
Some
English.
component.
Yeah, but those two agencies are pretty exclusive with that population.
Thank you.
Let me just ask a quick question on that, because that was good to know that. It might be in the current application process, and I just haven't seen it, but is that something that they can check off or something that we include in the questions if they offer Spanish-speaking services? That just came to my head right now.
Yeah, so we don't have anything exclusively like a check if you offer that services, but many of them will put it in their narrative in the application.
So they offer it up. Okay.
And they're also, just to complicate it, but really lay the groundwork for where we are, this is not all the social service agencies in town. And it's not all the ones that do anything. Some are exclusive, but for the most part, like, we have a lot of daycare programs in town. We have more than one senior center. There are reasons for that. And so there were reasons, I remember when the Latino program came in from Community Action. There is a question, or there used to be, on the application about, is this a duplication of services? And we ask the agency to describe where they fit in, if there are other services like them, why are they important? And there's even scoring, isn't there, on that, Corey?
Yes.
Yeah,
there's-
unduplicated services, there are 5 points in the scoring sheet that we'll get to about that. Of course,
I see it.
ideally, the more knowledgeable the Social Services Committee is, as well as the reviewers, and whoever is staffing the reviewers, the more you can make sure you've had a good conversation about that.
That's why I asked the question, because beyond duplication, if there's some opportunity to coordinate services, so that we get biggest bang for our buck that we are listed, so that we can stretch it as far as possible.
Exactly. And the model that we have, that we'll go through today, that we've had, doesn't really allow that kind of subjective, if you will, assessment about whether it kind of takes the entity as it is and says, are you doing a good job with what you're doing? Doesn't get into that broader picture of, well, how many people do this in town, and do we really need this many? Or correspondingly, in terms of the funding, there are other funding sources as well. And so if an agency is able to get a substantial amount or all of its money from a direct federal entitlement grant or something, like Community Action gets most of its money through Health and Human Services, because there are agencies like that all over the country, and then they decide what local programs they'll do and get it extra money to do some of those things. Some agencies are on United Way, and that's a substantial part. The aging mill levy is there, so that provides a substantial amount of money for senior services. So our system also doesn't really allow to sit back and assess, or it hasn't so far, like, the duplication piece or the other money piece. Is there, you really need this, or are there other sources you could go to get at this point? So. Again, and it evolved this way because the prevailing feeling on the committee, and staff was very helpful in that, was to come up with a scoring system that was as neutral as possible, and kind of empirical as possible, rather than subjective, to be able to defend that at the committee with the volunteers reviewing and scoring, or staff, in the case of staff, and then a council committee getting it, and then standing by it, taking it forward to the council.
Right.
I'm not sure there's any system that's perfect, but that's kind of, does that make sense?
Well, it makes sense to me because, I think what's really important about the minutia that we're going through is that we're going through it. And that we will, at least I'll be more versed to be able to do that standing behind that we're talking about. Obviously, there's going to be some things that, have to ask staff questions on because they're the experts on it. But if we come into something, during a council, session, and we're just kind of looking around because we haven't
Right.
gone deep enough, then that is a concern. So I appreciate that.
If I may.
Yes.
Thank you. I have another question here on the graph. It's probably a simple answer, but in those areas where it shows NF non-funded, does that mean that they applied and weren't funded, or they just didn't apply?
They applied and weren't funded.
Okay, so if they're on the sheet, they applied.
Yeah, well, there are some that did not apply, and if it's just a little dash in the, if you follow the
Okay.
row across, those dashes.
Yeah.
Okay.
Yeah, are equal to did not apply.
And there is a whole nother sheet that shows you the agencies that were not, that applied, that were not funded. It's in another sheet, so you can, a visual, so you can see for each year what agencies didn't get funded who applied.
Now, is that in addition to this
figured that
list, or
was
is it
Yeah,
breakout?
it's in your packet.
breakout.
It's,
Oh,
I can tell you
later?
the tab. It's 4C.
Oh,
We had it tied to your appeals item so that you, when you
Okay.
got to discussing that, you could see.
It's the blue one.
So the or the yellow is the appeals information that you guys asked for, and then the one immediately behind it is, these are agencies. Oh, whoops, I got it upside down.
oh, I think you've got them all on. If they applied, though, they're on this chart, right? No?
If they, no, the blue are the ones that applied and did not get funded because their score was too low.
Okay.
Right, but I see some, I see them on here.
Yeah,
Pardon me?
yeah. We
Yeah.
created these other sheets because this makes you cross-eyed if you look at it too long, and it's
Okay,
way
yeah.
easier
But
to.
It's on
there's
there.
nobody on here that's not on
No.
here. That's.
Yes,
that's-
yes, ma'am. Those two other sheets were
This is just
created from
detail.
this information.
Trying to throw me a curve here, putting it in upside down.
I'm sorry. And I did collate you guys, so that's my fault.
No, that's all right. I figured as much about that. It's just, yeah.
Yeah, this is so small, it's hard to read it.
This will be helpful. This is good. Okay, so NF means they applied but weren't funded, and a dash means they didn't apply.
Says that, there's that little
There's a little key down at the bottom. But this is this lists every single agency who applied in the course of that 5-year span. Okay.
Every agency that applied is for a particular year is listed.
Yes. Well, Mike, you figured out there's no 4D editing?
Yeah.
Shoot. There isn't one. It was a test to see if we were looking. It's a lot to absorb, I know. Fortunately, maybe it's already obvious, I was in on some of the early years and maybe one in the middle, but Corey and Rochelle and Sasha have been involved through the whole time. So between us, we should have the history. You ready to move on to the
4A?
to scoring? All right. We can always jump back and check things if we need to. Okay, the scoring is one of our action items. Is that needed to be finalized?
So on
Looks
that
like-
item, you have the score sheet, and then the application is immediately behind it for you guys, just for your information. This application is just a dummy application that staff went into EC Impact and filled it out so that we could generate it for you and not clutter it up with a application from past years.
Thank you for that. So, and Mike, you were involved in the discussions from last year's committee. What we saw in the minutes that we inherited was that there had been some conversation about, which there was every year, about diversity on boards and attendance. And you can see that staff is proposing a couple of changes I think might work. The council committee in the past has chosen not to change that despite comments, and so we can have that discussion. And then, sounds like many of the concerns on the appeals this year were about the staff scoring. This last past grant administration is effective. And that's been the case in the past. We've had some scores change before in the past on that, as I recall. So you're proposing, if I can recap from last time, to simply take it out at least this time to get your scoring out of the mix, though that this might go back in. Is that?
Yeah, we're proposing to take it out. It's been a constant contention with it, and so we thought, well, let's just take it out and use and weight a little bit differently on the scoring process this year. And because we're using a vendor, we think it's more appropriate.
So that would be what's marked out as past grant
red line.
administration is effective.
Yes.
10, 5, and 0.
And Sasha, I think you gave us some explanation at our last meeting about the thought process behind that too, just like you suggested.
Yeah.
I asked you that last week.
Seems
It's in the
cleaner
minutes.
if we're going with the vendor, because then we have one organization touching the scoring piece rather than two. And then again, with the idea that you guys have the ability to bring it back in the future, whether that be for a vendor or for staff, whatever.
I would suggest that the other angle on that would be that I don't even know if there's a need for additional guidelines when you give this scoring to a third party. But I've always felt like, well, I think we shouldn't do new programs. I think we should only do programs that have at least 3 years of history to them. That's just my personal opinion. But I also feel like if we do want to score grant administration, then if the entity hasn't, that we should have simple enough guidelines for that if the entity hasn't been funded by us before, we could check, kind of like checking references on an employee or a contractor or consultant. You know, you could check with whoever has funded them in the past, and see what their timeliness and completeness record has been, that it wouldn't, rather than exempting new agencies from that, which is what we do now, or what staff has done so far. So, or there's the issue is, do we even care? As long as they eventually do the work, if they're late or make mistakes and need help on redoing their forms, is that something we score? It was important to the staff when we started this process. So,
Yeah, the whole thing about, agencies needing help and, perhaps what I was hearing, and I don't know how this is going to play into the conversation, is that there were attempts to put information into the system and it didn't take. And then there was some testing on the system with one of the agencies with some staff to see if the information was coming through. So I guess two things. With outsourcing, does that mean that those glitches, because they'll be using software that they have already, right, in place, that they're,
question that I had, actually, I don't
Yeah,
know.
that's the question I had.
because I don't even know what the software is about, what it's called or anything. I think you said it already, but I didn't write it down. And then after that will it be the third-party entity that is, and will it be stated that, they are to assist with any questions or submitting issues or all of that? And I understand that, Sasha, you had said that there are a lot of peer organizations out there that, can help them, but this all makes that those two things that I was just saying makes me kind of look at this and go, okay, yeah, we need to seriously discuss that. I don't know if this is the right point to do it or not, but
So just, I can respond to that. Our staff's expectation would be that in the contract, we would include language that would clarify that expectation of service to the agencies. We have the expectation of whoever we contract with, that they provide that same level of service, and maybe better. I mean, better would be great, right? Than what they're already getting. So we have every intention of trying to ensure that the agencies get as much support as they do from us.
Madam Chair,
Please.
if I may, to follow up on when Councilwoman Alcala stated, there were some conversations about issues about entering information into the existing software program. And I don't know that I ever received some clarification on if there were in fact issues, or if it was often is the case when I'm trying to do something operator error rather than the software itself. And was that looked into to see if in fact there were? Because I had a couple people who came to me and said that we would put something in and it would kick back out something totally different. And we tried to make that correction 2 or 3 times and it would not. So I don't know if then that was resolved through a personal conversation or communication, or if in fact there was some software glitch. And if that is the case, would our outsourcing vendor, and I think Councilwoman Hiller asked that, would they be using their own software package, or would they be utilizing the cities or have access to the cities to process the applications? So 2 questions.
So I think, I don't think any agency will argue that Rochelle is extremely available for any problems that a system has. And we all know that it's not our system, so we have to work with the system that we have. And so Rochelle, sometimes it is the system's error, and sometimes it's the operator's error. But Rochelle works through those with the person, the vendor that we contract with for EC Impact. EC Impact was actually suggested by a committee, this committee, several years ago, and many of the agencies, maybe not all, but many of the agencies wanted that because another agency in town was using the same system and they felt pretty familiar with it. So that's kind of the history on why we're using EC Impact. I think when Sasha and I create the contract for the vendor, the discussion on whether we use EC Impact will be had then. We haven't made that decision yet. Is that fair to say?
So the RFP states that the vendor will provide a system to receive applications and the required documents, but we have discussed that EC Impact license that we pay for and haven't made a final decision internally on whether city would maintain that contract and just give a user license to our vendor and have them use our system. We want it to be able to be flexible so that depending on who our proposals come from, some may come with their own software or online portal. Some may not.
I think we want to be sensitive to the agencies on that too, in terms of not switching out on them. I get it, but people did respond pretty well to it, and it seemed that overall it was an easy slide into being able to do it. The only thing I recall hearing was there was some limitations on the reporting functions.
can we ask, have anyone's had any major issues with this system?
Sure.
EC Impact? Anyone here?
Sure.
Agencies? Had a problem? Seamless? Good. You want to say seamless?
So I don't know still that I've got a definitive answer, and I don't know if there is one. Was the system checked to see if there are any issues with it? Or
Naturally, of course, when a problem arises, Rochelle works with the vendor to fix the problem if there's a problem. I will say that those agencies that have problems with reporting, for example, were never dinged on their past grant administration if it was a system error. So just for clarity on that. But yeah, anytime and systems, as you know, they do fluky things from time to time, and so we have to just work with the vendor, fix the problem, and then and Rochelle will work with the agency to make sure that it's working properly. So we have not had any major complaints of that, so I'm surprised that you're hearing that out there.
I think some of it, and it's secondhand for me, because I've not been on the front lines of this for a few years, was that, for instance, there were deadlines, but if somebody called in and didn't get a return call until the deadline day, they'd called in maybe 2 days before, but on the staff end, the return call didn't come, and because then the interaction didn't occur till right at the deadline, then the resolution occurred after the deadline, and, a sense that it was.
And we are not counting that as not good past grant administration. That would
Okay.
not be considered if it was a delay in staff response for a deadline.
If it was my error, system error, the deadline was always extended.
Okay, with the Poppins Landing, was there an issue with them getting it in late? My understanding of that was that they had put in all the information into the system, press for submit, or however that's done, but then they were told that the grant was late. Am I remembering that correctly? Did they get dinged for Poppins for it being late?
Happens on an application being late? No,
Okay.
never.
Okay. Right.
Because if it was late, the system has a cutoff. It'll clock out. If it tries to get submitted after the deadline, it won't let them submit. But there was never a time. Their applications were always on time.
Okay.
Okay. Well, we can go, let's pause for a second. Do you want to start at the top of this and go through all of them, or only, this is to the committee? So that we understand, it might be helpful to have staff walk us through, in a long time, but which sections of the application are looked at to arrive at this score?
If we have the time, we carved it out, we might as well take advantage of it and
All right,
get a clear understanding.
Okay.
'Cause I don't want it to be assumed that second guessing every step. I just want to understand it better. And I think
exactly.
if we all understand it a little bit better, there might be fewer questions at the end.
I agree.
Okay, so that means that we're going to go over to the contract first. And is there the possibility then during the course of this conversation that we can talk about the point system?
Correct.
And that,
That's where we're.
What we're going to
Yeah,
do is go
just-
through it in the order of the points, I think,
okay, good.
but using the application in terms of where, you walk us through whatever makes most sense.
I think Rochelle's most familiar with the application, so she's marking it up right now. If you can give us just a second, we'll
Okay.
have them tied to the
Well, and you tell us
individual.
whether it makes more sense to go through the application and then walk us over where the scores are, or the reverse.
Which one's easiest? Do you want to start here and then come to the application, or do you want to
Yeah.
start with the application and go to the?
We can do this one first.
Okay.
Give me a minute.
Does anybody need a break? While we wait?
Anybody need a break? I think we're good. You?
No, I'm fine.
That's passed.
All right, I think she's got it ready. You got it?
Yeah, I think so.
Okay.
Okay, so on your score sheet, you have a need 15 points. I'm looking at the application page 5. There's a narrative describe the community need.
Okay, in the middle of the page.
Down below narratives. Describe the community need that this proposal addresses and how it is related to what you are trying to accomplish. So they would answer that question, and then the review committee would decide upon their answer. 15 points is a need clearly stated and ties directly to the outputs, outcomes of this program. 10 points, need is clearly stated and program somewhat ties to the outputs and outcomes. Or 5, need is not clear or does not tie to the outputs and outcomes. Or 0 points, need was not defined and does not tie to the outputs and outcomes. So your outcomes,
That's what I was going
if you need to review to those, are on page 7, which also correlates with the next section of the score sheet, issues and outcomes. Outputs are clear and related to identified needs, and then the next section, outcomes are clear and related to identified needs.
I have a question, if I may. On the outcomes, like number of persons served, let's say, it says here for 2018, it was 20, in 2019, it was 25, and projected is 2020. If we had said we were, as an agency, was going to serve 25, and we fell short by 3 or 4 people, how much of an effect does that make then? I mean, if I fall short by 2 or 3 people, does that pump me down into a whole different category from maybe a 10 to a 5 or?
So the outputs and outcomes are both factors on the bottom score item, outputs and outcomes on prior grants. That is a factor. And so if they say, I'm going to serve 100 people and then serve 50 or 99 and 100, however you want to look at it, it will factor in. So if they have 4 outputs and 4 outcomes, a total of 8, and they don't make their output, but everything else they make, then they would get 7 out of 8, which would be a percentage. And then you can see the percentages on the score sheet that if it, depending on, what that percentage is, it would fall into one of the scoring categories there. So it is a factor.
So if I was a cautious applicant, though, and I thought I could do 25, but I'm only going to say I'm going to serve 20, and then I do 25, then that kind of gives me a little cushion.
Yeah, I mean, if they want to fictitiously write their application, I suppose they could.
I'm just saying that,
Yeah.
But if, just following along that line, understand that an outcome is what for, what are we doing? We trying to accomplish something, prevent something, that's what you're measuring, and it ties back to that need. What's wrong? What is it we need to fix? What's the problem? And that outcome is supposed to tie to that need. But it is a performance issue. What happened? Did we prevent homelessness or not in this case? And then how many people is the output? How many? And it could be different things that you're going to do to accomplish that if this was proposed, the actual was 20 in 2018, proposed for 25 in 2019, and projected for 25 again in 2020, how would that go?
If they had the same output each, it would not have an effect on a score.
Just want to make sure you knew that. And it's not driving up those numbers,
No.
especially if they're going after the same amount of money. Can't always expect somebody to do more.
Additionally, if an agency asks for 25 and gets funded at 15, we give them an opportunity to revise those outputs that correlate to the lower score, or the lower dollar amount that they're getting. So they have that opportunity at contract time to revise those outputs.
I want to talk about that a little bit later, but we have to do it right now.
So when we're looking at the outputs, how many served, and let's, like Mike had said, maybe they fell 2 or 3 short, how many points could that ding them? I mean, is it 10, 8, or 5, or is it, oh no, it'd be 10 points, no. What would it be? I mean, how much could something like just being short 2 or 3?
That would be a function of the total, right? Because if my total is 5 and I'm 2 or 3 short, then my percentage is much lower. But if my total is 50 and I'm 2 or 3 short, then I'm up here in that 90 percentile.
Okay.
So that would be a direct function of their statement of what they can accomplish, basically.
Got it.
And that really hasn't been an issue that I know of, but
Okay.
this one at the bottom of the page that understands that you can flop up and down a little bit just because of what happened.
Got it.
So. Proceed?
Okay.
Ready?
All right, so right after the 2 output and outcome question, you have plan has been identified to measure outputs and outcomes. That's also on page 7. Describe the data source, the data collection method you will be using to assess output and outcomes attainment. And so they would need to answer that. And
There was a question that carried forward from, I think maybe one of the appeals, that, as it got to me anyway, didn't seem clear at the time. Someone had asked, what's the difference between an activity and a program? Is there any difference?
I don't recall the initial conversation. Do you know what she's talking about?
I'm sorry, say again?
Is there a difference between what we're calling an activity here and a program?
More like the program would be where there is no activity.
Does it say activity in the application?
But
Where are you seeing activity at? I'm sorry.
Activity is here on the application.
Okay.
It's not really used on the
what page are you on? The
7.
page 7.
So it's like if you have an evening meal program, one activity.
Are you asking that because of the difference in verbiage from page 6 and 7? Or that question came up?
It came up, and I guess it came up perhaps program funding history and
Right.
then activities. When you have outcomes, if you want to prevent homelessness, how many people are you trying to work on in your activities could be what are you going to do?
It's right here.
A program could be more broad with activities within it or not, so I just wanted to bring that forward.
It's not scored anywhere.
Well, I think the way that this application is set up, which we do have some control over that through EC Impact, but not complete control, because they have like a design. I would be curious if this activities
part
is
of
like
their
a heading
design.
for them. But to your point, and I'm not an expert, I just play one on TV, activities would be what you're doing inside of the program, wouldn't they be? Like
I would think
if
so.
the program is gonna prevent homelessness, then how are we gonna do that? We're gonna, and then you're listing the actual tasks or functions, the stuff that you're gonna do, I would think. But I don't, do you felt like there was some, because what I missed earlier was the conversation, what conversation?
I don't recall.
Did you feel like we had a conversation about that at this committee?
That was my understanding. Perhaps that one of the appellants, one of the agencies who had appealed, had asked that question and didn't really get an answer. Okay, thank you.
No, she's not here.
I think I just.
Well, I don't want to belabor it too much. I just wanted to bring it forward because it had come to me, and thanks for the help on that question had been asked and not answered.
And so what we may be looking at is just a clarification on the program.
Do you just want us to
Verbiage.
change it to program? That's pretty.
I don't have a problem with it, actually. I mean, a program might be, as Sasha said, this is our meal site. We're gonna make sure that people eat, and we're gonna make sure that I'm guessing broadly because I'm not looking at anybody's, but if a senior center, for instance, has social activities at their lunch program, and they have eating activities, and the outcomes they're trying to reach are to make sure people are well fed, and that they have some socialization, that their socialization is sustained, and so the program is the meal site, and the activities include eating healthy food and having some sort of social interaction, then those would be activities. You think that would have answered? All right. I just wanted it had lingered out there somewhere.
So I don't think there necessarily, in my way of looking at this, I don't think there necessarily has to be a changing in the verbiage, just so there could be an explanation to the question if it comes up for these third-party people that are doing it.
Fair enough.
Yeah.
Okay. I think that's one reason why the question has come up and will as we wind this down, I'm sure. If people are calling, I remember when we first started this, it was like, well, if you guys were doing the scoring, then maybe you guys shouldn't be doing the coaching on how to fill out the application. And this concept of separating who's doing the scoring and management gave the opportunity for somebody else to be coaching on how to fill it out. But at the same time, that conflict of interpretation. So you're thinking that you'll do everything you can with the vendor, and the vendor will both do the coaching and monitor the scoring process.
Yes.
Yeah, we'll have to see what we get proposed, right? To see,
Sure.
but that would be an area that we would want clearly defined for our own purposes.
I would think so.
Because I think we all agree that that's kind of important, right? I can't.
Well, and that's what's, the issue of, people trying to do it right and getting advice and trying to follow the advice, and then if they get dinged for following the advice that they got, then, or trying to file paperwork as well, how do you ride that line so that people get treated fairly?
Well, I don't know that I couldn't be involved in that pre-application process and kind of the coaching piece and then look at the application nearly as objectively as if I wasn't involved in that questioning on the front side,
I know. So we're still planning to have the vendor is still supposed to have outcomes experienced panel. Is that part of what's going across?
That would be our preference, but I hate to box ourselves in until I see what you know what I'm saying?
Okay.
Because I don't know what different kind of systems out there exist for grant application review.
Well, but if you've got somebody that doesn't understand the difference between outcomes and outputs and programs and activities, then they can't score it. They can't effectively score the needs or the outcomes or the outputs and on down the line.
Which we're we're definitely looking for someone with experience in that
Okay.
grant administration and just,
But not everybody who's done grant administration has worked with outcomes.
okay.
I sat in through Rochelle's training a couple years ago, and there was a new person to the committee, and she'd done grant administration for years, but she didn't know what an outcome was. She'd done housing stuff. She had no idea. So it's not that simple. All right, can we move on?
Okay. Okay, so unduplicated services or any duplication with other services is explained and adequately defended. On page 5, there's a question, like third from the bottom. Please discuss whether this service is duplicated by another agency, and if so, address why this duplication is justified based on the community need. So they would answer that. Review committee would score 5. Service, no, okay.
Good?
Yeah.
Good, Mike? On the duplication?
I'm good.
Okay.
Okay.
Then we already did the next question, right?
Capacity, let's see, on the page 1, it's history and capacity, then on the application, and it goes to the page 2, how long has your organization been in existence? Describe the training and/or years of existence your organization and/or its key staff have in proposed program area. So they would answer that question. Review committee would score them.
We good? Mm-hmm. Question, Mike?
Oh, I was just looking at this on page 2, I guess. Is how does your organization collect and make use of client feedback regarding programs and services?
That's the next one.
An example is send out annual surveys. If you did additional stuff like, on a weekly basis, you visited with clients and did some tick marks on how good the service was or how good the food was or whatever it is that they're providing. That just goes to show how much effort you're putting into that feedback. It doesn't give you a higher score. It just keeps you at a high level because it shows more effort in that area.
That's the next question on the score sheet. Agency has formal process and is using client input.
Okay.
That's where that, how does your organization collect and make use of client feedback regarding programs and services?
So the better they do that and the frequency of which they do that, other than an annual survey, would keep them at the higher end.
Yeah, I don't know that we measure frequency when we're looking, or the review committee is looking at that decision. I think it's a matter of, not just that you're collecting it, but you're actually using it to better
somehow.
your program.
And would explain that
That is what the scoring criteria is more about.
And so if on their feedback, if they said a certain change need to occur, then they could explain that they addressed that need and how it did make an improvement or didn't.
Right.
Those kinds of things.
Well, and this is not just, when you're measuring outcomes, some of them, they have to either be something you can observe and count, or it has to be reported by the client. It can't be your opinion. And so you need feedback. If you need to know whether people are feeling better when they walked out the door than when they walked in the door, you have to ask them. You know, if you weren't there with them and you need to know whether they did visit with anybody during the day, during their lunch hour, you have to ask them. So it would vary based on what was being surveyed. But you might need to do frequent client feedback just to be able to measure your outcomes.
Quarterly or more often.
Or more often. You know, if you're, for instance, if, I'm thinking back to our HCCI days, I mean, if you counsel if somebody needs to prevent or resolve a problem, you can measure whether that problem got prevented or resolved. But if they went to a class, the only way you can measure is to find out if they learned anything. So you ask them, you know, some sort of feedback at the end of the class in terms of whether they feel more confident, whether they learned anything, and for your information, what was that, so you know what struck people. But it's the only way you can measure your outcomes.
So are
Many
you,
of them, you
so
have to ask.
are you saying that as we look at this particular piece and want to make sure that the money that we're stewards of and allocating to agencies, that perhaps we should make it more stringent on how they're collecting?
I'm not, because it's so different depending on what the outcome you're trying to measure is. And certainly you do want to know, I mean, many agencies also want to know, did you like the, you know, did the staff treat you well? You know, customer service
Yeah,
kinds of stuff.
that's good.
And that's important to do too. That's not going to measure your outcomes. Whether they like your staff doesn't give you an outcome. So that doesn't count. But certainly that feedback gets you a better organization. So the reviewers, that's one of the reasons, and help me if I'm over speaking here, one of the reasons you want seasoned reviewers is because they can pull a fair amount out of that when you describe what you're doing. They can see whether you're using it for your outcomes or customer service. Either way, it reflects on your management. I haven't ever sat down with a group and gotten totally inside their heads on how they do this, but they're seasoned enough that they can cross over some of these answers to come up with their scores. So.
Just a quick question again, and maybe this is just an arbitrary assignment of value. As we go down through this, issues and outcomes, that is 10 for its highest score. Plan has been identified. That highest score is 5. Unduplicated services, that highest score is 5. Where do we get the highest number? Plan has been identified to measure outputs and outcomes. Rather than a 5, why isn't it a 7, 8, 9, or 10? Just wondering.
That's just honestly just the way that it was created, but everybody has equal opportunity for a 5, 3, and 0, and it's less subjective. Like if we go from 5, 4, 3, 2, 1, we have to have measurements for all of that. And how are we going to distinguish between the 5, the 4, the 3, the 2, the 1? It becomes harder to not assess exactly what is either in there or it's not in there. So that's why the committee has never decided to change that fact.
Okay, that I understand, but again, why is 5 the highest achievable rather than 10 like the other two above?
So this committee is the weighting, and we can determine the weighting. As you can see, there's 3 questions on outcomes, so that's 25 points of the 100. So you have 25% of the weight being towards outputs and outcomes, and I think that's kind of what you're trying to do today here.
Okay.
So, yeah.
All right, thank you.
You know, an example might be, let's take a youth program. I'm thinking back to when this was structured in the first place. If all you're doing is collecting these kids and they're out of control and they all get a cookie and they go home, is that what you wanted to fund? Versus, you know, where the outcomes were that they would be in a nurturing environment, they'd go out without, you know, it would contribute to them, and this could use some tweaking because I'm making it up, but that their homework is done, they're ready for school when they walk out the door, they have had something nutritious to it's contributed, the output is that they get something nutritious. The outcome is that we're contributing to maintaining their health, their schoolwork, and their socialization in a positive way. And then your activities would show that what you're doing, so that you want a managed environment where they get their energy run off, they get something healthy to eat, get help with their schoolwork if they need it, and they walk home in good shape. You put those pieces in to be able to measure, just to set a standard and to measure. And I just butchered it, I'm sure, so Boys and Girls Club can just go, oh, glad I'm writing my grants.
Well, I get all that, and I think I understand more what Corey said, is that it's whether or not, how much weight do we want to put on that particular
Correct.
piece as opposed to anything else that we have before us.
Correct.
I just want to note, Sharon, that it's 11:15, if we want to take a small break. I know that's what you were saying too, that time frame for Rolando.
If you're ready, let's go ahead and do it, because I think
Yeah,
we'll
so we
need to
can-
discuss more on these end ones, so, all right, thank you.
Five?
5-minute break good enough? Okay, 5. Thank you.